I've been asked to talk about which studies are appropriate to use to estimate the PM2.5 related mortality associations in California. And so, now the next one. So I'm going to start with this slide of a study that was done in New York. This is a study in hyperlipidemic mice. Basically, they exposed half of their mice to normal chow or a normal diet, and they exposed half their mice to a high-fat chow diet, and then they divided up both those halves into mice that got clean filtered air, and then those that got PM polluted air, and these were environmentally relevant. In fact, they were about the levels that we get commonly in the valley where I live during inversions during the winter. And basically what they observed is that the high-fat chow diet contributed to the acceleration of these atherosclerotic lesions, and that was especially true in the PM polluted or the PM exposed mice. You saw the PM exposure influenced the normal chow mice and the high-fat chow mice. But it was, it is mice, and you might object, what does this have to do with California people? It's not even the right species, right? So go to the next slide. Let's move. Here's a study that was looking at ischemic heart disease events triggered by short-term exposure to fine particulate air pollution. Now we're in the right species. These are humans. We can't sacrifice these folks to look at their coronary arteries, but we can use angiography to look at coronary arteries, do a case crossover study of acute ischemic events, in this case in about 13,000 well-defined and followed-up cardiac patients who lived on Utah's Wasatch Front. Bottom line, next slide, and in fact, let's go straight to the next one. The bottom line is that there was a significant increased risk of these acute coronary events in this group of patients, but especially in those that already had existing coronary artery disease. Now you might say, well, what does this have to do with California? Well, it's the right species, but let's move 1,000 miles closer. Next slide. It turns out that you can look at subclinical atherosclerosis using carotid ultrasound to measure this CIMT. This is a safe, non-invasive technique that evaluates the burden of subclinical vascular, basically atherosclerotic disease. Next slide. And then there's this very interesting study done by Nino Kunzli and his colleagues. Basically what they see is this sort of measure of subclinical atherosclerosis was associated with increased exposure to PM2.5 in the LA area. Next slide. And of course in California there's been a number of really high quality studies that have been conducted. The Southern California Children's Health Study, a study of the effects of air pollution on children's health, focused on primarily on lung function. Next slide. But this study shows that deficits in lung function growth amongst children living in cities or communities with different pollution levels, what you see is the deficits, that is the reductions in lung function growth, is higher in those cities where the children are exposed to more air pollution. Next slide. Another study, this is just using basically the same panels of children, but instead of looking across communities with higher pollution, they're looking at children that are exposed to traffic pollution, primarily based on distance to freeway. And again, deficits in lung function growth are observed to those children that are exposed to more air pollution by living near the roads. Next slide. Now this goes back to what I was showing earlier this morning. We have now a whole bunch of studies looking at mortality and long-term exposure. These are the results often emphasized by James Instrom, which are unquestionably some of the lowest results that we see across these studies. They are California specific. Then we have this California teachers study, unquestionably amongst the highest that we see in terms of effect estimates. I guess I don't actually emphasize either one of them. I think they give us some evidence as to what range of results you get from some reasonable estimate or efforts to analyze data in California. Next slide, please. there have been a whole bunch of effect estimates from the California. So basically, of these estimates that I showed earlier this morning, these are the published estimates using California-based data. Michael's already done a nice job of sort of talking more about the details of these studies. Next slide. So, you know, where do I come down in terms of what studies should we use? Well, I guess the question, are hyperlipidemic mice in California less susceptible than those in New York? Probably not. Are Californians' children's lungs and adult cardiovascular systems less susceptible to fine particulate pollution than those elsewhere? The answer is probably not. Is pollution from California cars, trucks, and other sources less toxic to humans than elsewhere? It's not as clear, but probably not. I mean, the sources of fuel, the types of automobiles and trucks that we use in California are similar to those elsewhere. Then which health studies are relevant to California? Well, it's clear that some of the highest quality research on the health effects of air pollution has been conducted right here in California. And the results are roughly similar to those those from elsewhere. And again, we just don't have time to talk about all the toxicology that's been done here, the various panel studies that have been done here. But the reality is if you look at the overall evidence with regards to California studies relative to other studies, it just makes you think that the hyperlipidemic mice here, the children here, the cars and trucks here are not that much different than those elsewhere. So it's evident to me, at least, that well-conducted epidemiological, clinical, and toxicological studies conducted both in California and elsewhere are relevant. Thanks.